I'd like to inform you of something that I feel needs to be addressed today. On Halloween night, while most Americans were turning out the lights, the Center for Medicare and Medicaid Services, better known as CMS, revived a long-dead medical regulation that could devastate access to care. Billed as a way to cut rising costs, the rule would impose new regulations on wound treatments while slashing reimbursement rates. Yet, these changes misinterpret the cause of price hikes and threaten an industry patients rely on. At issue are allografts, placenta-based skin substitutes that cover chronic wounds and promote healing. For years, the Food and Drug Administration has allowed these products without clinical trials because they are widely recognized as safe and effective. During COVID, their use exploded as regulators allowed them to be applied with minimal oversight in nursing homes and mobile wound clinics using the telehealth exemption. While beneficial for many patients, these changes came at a very high cost. After already rising year after year, Medicare spending on allografts is expected to jump another 50% from $10 billion in 24 to $15 billion this year. This growth rate is unsustainable. Unfortunately, in 2024, Biden-era regulators responded with draconian price caps that could bankrupt the skin substitute industry and leave patients stranded. This is important for people that have diabetes, for example. The Biden rule was set to take effect this year until President Donald Trump personally intervened, declaring concern for saving the lives and limbs of Americans. In a graphic he published on Truth Social back in March, he blamed Crooked Joe for ramming through a policy that would create more suffering and death for diabetic patients on Medicare while increasing unnecessary amputations and deaths. President Trump made it clear this policy would never be implemented, not on my watch, he declared, warning the Biden-era rule would not only kill innovation, but lead to more ER visits, more amputations, and more mortality. At first, his administration appeared to heed his call. CMS quickly paused the rule until next year to determine a better policy and best path forward. Patients and producers breathed a sigh of relief until bureaucrats used the confusion of a government shutdown to resurrect the Frankenstein regulation with even harsher restrictions. You heard me right. Under the new final rule, CMS would reimburse all skin substitutes based on the smallest possible graft size, a price so low only a few of America's 50 skin substitute makers could survive financially. While this would artificially reduce prices in the short term, it would leave only the least innovative companies selling the cheapest, limited-use products in the marketplace. CMS then inexplicably made the problem worse by allowing an arbitrarily defined subset of skin substitute companies that previously supplied clinical data to receive higher reimbursement rates starting in 2027. Not only would this lift prices back up from the government-induced low of 2026, it would effectively provide state sponsorship to a small number of chosen medical providers and manufacturers. And it is a chosen group. Most companies reasonably decided not to spend millions on trials that the FDA didn't require. If those companies now wish to supply data and access fair rates in 2027, they can't. CMS hasn't explained what data these trials must show, even while the FDA still deems these products safe without them. It's crazy, right? When the industry tried to reason with CMS and Congress tried to exercise oversight, CMS ignored the request. Meanwhile, in an unbelievable coincidence, one of the companies vying for a government favor, Extremity Care, donated $5 million to President Trump's super PAC earlier this year and another $2.5 million to the White House Ballroom Fund, a red flag of pay to play. If this all sounds like a communist-style Politburo picking winners and losers behind closed doors, I don't think you're far off. Alec Armanda, Kimberly Brandt, and John Brooks, the top leaders at CMS pushing these policy changes, have deep financial ties to the healthcare industry as former lobbyists for the likes of Eli Lilly, Pfizer, Blue Cross, Blue Shield, and more. Now, these corrupt actors have gone behind President Trump, Health and Human Services Secretary RFK Jr., and CMS Administrator Mehmet Oz to line pockets and hand out favors to politically connected companies like their future vacation homes depend on it. Worst of all, none of these solutions, and I use that term lightly, will work because the spike in spending isn't due to high reimbursement rates, but to weak oversight. During COVID, regulators allowed providers to bill Medicare and Medicaid for skin substitutes with almost no safeguards against fraud. Price caps won't stop that. They'll just make care harder to access. If CMS truly wants to control costs, it should target fraud, not deceitfully take the job of the FDA and punish the patients and innovators who have made modern wound care possible. At the same time, the government should create a level playing field. All skin substitute products certified by the FDA should be approved for reimbursement. CMS should rescind the destructive pricing mechanism that would and will bankrupt producers. And the administration should work with the industry to establish a realistic pricing scheme. President Trump made it clear he wants the Biden-era rule buried for good. The question is, will CMS finally comply? We'll keep you posted.